Good morning and welcome to UroNurse News. Hey, be sure to like and subscribe. I'm Vic Senese. A new NIH-funded study suggests that artificial intelligence may soon help clinicians analyze CT scans faster, predict disease earlier, and potentially streamline clinical decision-making. Researchers have developed a powerful new machine learning model called Merlin, designed to analyze three-dimensional abdominal CT scans and extract far more information than traditional image interpretation. You've heard me talking about this earlier, that CTs and things like that are going to be read by AI. In fact, the system may one day help clinicians move from imaging directly towards diagnosis. The project was founded by the National Institutes of Health and involves scientists working with a massive clinical imaging dataset from Stanford University School of Medicine. To train the model, researchers used more than 15,000 abdominal CAT scans, linked radiology reports, and nearly 1 million diagnostic codes. By connecting the visual imaging data with the written clinical reports, Merlin learned how to recognize patterns between anatomy, imaging findings, and medical diagnoses. According to Bruce Tromberg, director of the NIH National Institute of Biomedical Imaging and Bioengineering, large data sets like this are essential to push the limits of what artificial intelligence can accomplish in medicine. The results, well, they're impressive, folks. Researchers evaluated Merlin across 6 broad categories of clinical activities covering more than 750 tasks. These included identifying organs and anatomical structures, predicting diagnostic codes, assessing scan quality, generating radiology reports, mapping organs in three-dimensional space, and forecasting disease risk. In many cases, Merlin actually outperformed specialized AI models that were designed for only one task. That's significant because Merlin is what researchers call the foundation model. So what are foundation models? Well, foundation models are trained on large, diverse data sets and can perform many different tasks rather than just one specific function. Think of it as a general-purpose AI for medical imaging. And when researchers put Merlin to the test, the system demonstrated strong predictive performance. Across nearly 700 diagnostic codes, Merlin correctly predicted which CT scan was associated with a particular diagnosis more than 81% of the time. For a smaller subset of diagnosis, accuracy climbed to about 90%. Perhaps even more intriguing is Merlin's ability to look into the future of patients' health. Researchers challenged the AI to predict the onset of chronic disease, including diabetes, osteoporosis, and heart disease. Using only CT data, the system was able to identify patients more likely to develop these diseases within 5 years, roughly 75% of the time. That's notably better than comparable models, which achieved about a 68% accuracy. This suggests that AI might be able to detect subtle biological markers hidden in imaging data, features that human eyes might overlook. So researchers believe these findings could help identify new imaging biomarkers for disease risk that could open the door to earlier detection and preventative care. But the team didn't stop there. They also tested Merlin on something completely unexpected. Even though Merlin was trained only on abdominal CT scans, researchers asked it to interpret chest CT scans. Surprisingly, the model performed as well as or better than AI tools trained specifically for chest imaging. That suggests Merlin has learned generalizable features of disease rather than memorizing specific patterns. So what does this mean for healthcare? CT scans are already a critical tool in medicine, from kidney stone detection to evaluating trauma, tumors, infections, and vascular disease. But interpreting scans takes time and requires highly trained specialists. And with the growing shortage of physicians in the U.S., the demand for imaging interpretation continues to rise. AI tools like Merlin could potentially speed up radiology workflows, help prioritize urgent cases, provide decision support for clinicians, and uncover early signs of chronic disease. Researchers say the system could eventually allow clinicians to move more quickly from imaging to actionable insights. The research team hopes their approach could soon lead to regulatory approval for simpler applications, such as automated image analysis. They also plan to refine the model to handle more complex tasks, like generating full radiology reports. And importantly, developers encourage hospitals and research groups to fine-tune the model using their own data. The study was recently published in the Journal of Nature and highlights how artificial intelligence may transform the way clinicians interpret medical imaging. While tools like Merlin are still under development, researchers believe they could one day provide a powerful new layer of insight within routine CAT scans, turning everyday imaging into a deeper window into future health. That's the latest from UroNurse News. Hey, coming tomorrow on UroNurse News, could a non-antibiotic medication replace antibiotics for recurrent urinary tract infections? New research is raising an intriguing possibility. Anakinra, a medication that targets inflammation in the immune system, may perform as well as nitrofurantoin for treating acute recurrent cystitis. If confirmed, this could represent a major shift in how we manage recurrent UTIs, especially as clinicians look for ways to reduce antibiotics overuse and resistance.
UroNurse News every Monday through Friday at 9 a.m. Central Time.